The following portion of the Arizona Daily Mix is sponsored on behalf of Paralyzed Veterans of America by DS Simon Media.
When getting a mammogram, many medical facilities are not equipped to accommodate women with disabilities. Teresa recently learned about the challenges and the urgent need for accessible care.
Tammy Jones, thank you so much for being here. We're thrilled that you're here to talk about this very important topic. I want to get right to it. What are the common challenges that women with disabilities face when it comes to accessible health care?
My goodness. Some of the common challenges that we face range from once we arrive at a facility, are we able to even get in the front door? You know, is there a ramp that we can get to the door to get in? Is the door wide enough for us to get through? Another challenge that we face is once we're in the door, can we get back to the exam room? Can we get back to the treatment room? Is the treatment room big enough for us to get our wheelchair into? Can my caregiver join me in the room? As well as, you know, does the table go low enough for a person to transfer over to the exam table so that the procedure can be done? Another challenge that we face is the medical community. You know, with them, we need them to see us as women first. You know, yes, we are women with disabilities, but don't focus on the disability, focus on the women's health issues that we're there for.
Can you share your personal experience with the challenges that you faced in accessible health care?
Yes, some of my personal challenges have the second time that we found lumps in my breast, I needed to go to a facility to determine the status of the lumps. I arrive at the facility only to find that I cannot get in the front door. There was no accessible entrance that I could find. Another instance was I was able to get into a facility. I got back to the treatment room and the equipment wasn't accessible. The right equipment wasn't available for for the procedure to be done. In both of those instances, we had to stop, regroup, reschedule, and wait another couple of weeks or so for the procedures to be done, which was just very disheartening, very frustrating, make me quite angry. You know, that I did my part by calling ahead to see if it would, to make sure that they understood what my needs were. They said they had the ability, the accessibility, but it wasn't true.
I would see how that would be incredibly frustrating and scary because you don't want to be postponing important biopsies and tests when it comes to breast cancer. And of course, it's October, which is Breast Cancer Awareness Month. What is Paralyzed Veterans of America doing to address some of these critical issues that you've mentioned?
We are joining with Ms. Hannah Storm in our campaign this month to promote the awareness for the medical community and for people on a whole to make sure that they understand that facilities need to be accessible, equipment needs to be accessible, staff needs to be trained, so that they understand what our needs are, that when we call and we let them know that, you know, that they're understanding what we're asking, what we're saying. And we also want to empower women with disabilities to speak up, that enough is enough. You know, we deserve the same access to health care as women without disabilities.
What can people do to support the fight for accessible health care for women with disabilities and communicate what you've said, enough is enough?
We want you to join us at pva.org, sign our petition so that we can educate and make aware the medical community as to the needs that we want. So when the need arises and the health care is needed, that she has access to that health care.
Tammy Jones, thank you so much for your service, and thank you for being with us this morning.
And thank you for having me. It's been my pleasure.
The preceding portion of the Arizona Daily Mix was sponsored on behalf of Paralyzed Veterans of America by DS Simon Media.